Hi, I'm Mark Gross. I founded Dental Partners of Fifth Avenue probably about 40 years ago, together with my partner, Dr. Andrew Kaplan, who has retired as of January of this year. Upon graduating dental school, I really wanted to go out on my own. I wanted to be my own boss, first of all, but I wanted to do things a little bit differently. I grew up with a family physician, that we're very close to. We could call it any time, day and night. And that's the kind of dental practice that I wanted to have. Patients feel close to us. And over 40 years, we've treated families. We've seen multi-generations. We've gotten to know them. Most of the patients in my practice have my cell phone number. We speak to them over the weekends and so on, and we've gotten very close to most of our patients. So that's really what I strive to achieve. We build these relationships with families. We don't do any marketing per se, it's all word of mouth referrals. And it's very exciting, when a patient refers their child or their parent or their grandparent to our office. It shows us that we're doing something right. And I've gotten to know these families over 40 years, 45 years, since I graduated dental school. And it's very rewarding. Patients love it, and I find it very, very rewarding. And we've gotten very close to these patients. So I went to Columbia University Dental School. I graduated in 1980. The year after, I did a residency program at Mount Sinai Hospital. And immediately after that, I opened my own practice, renting space in a chair, which slowly grew. I then moved to East 84th Street, 6 East 84th Street, where I took in my partner. We also decided we're going to have specialists in our office. So in order for patients really to get the best of care, we have the specialists who come in, a periodontist and an endodontist, doing root canals, gum surgery, implants, so we can really control it. The oral surgeon, the periodontist has a question as to what should I do with this, or how should I do with this, or is this too salvageable? We're there, so we get the best of all worlds. We aim to have the patients see who we think is the best, for their care. So we do refer to oral surgeons. We do Invisalign here, but we'll send out to an orthodontist if need be. We send out to ear, nose, and throat specialists to look at things that we might find on the tongue. So we have a cadre of patients we refer out to. But for the most majority, are able to be done in-house. My staff has been with me. I've had people here over 30 years, 25 years. I think 35 years, and everyone knows them. It really is like a family. We try to offer the best of care. We do really the best we can, and I'm hoping for the most part we're very successful. I would love to say that I chose the Upper East Side because it's close to hospitals and stuff, but the reality, it's across town from my house. I live on the West Side. I walk across the park every morning, walk back, but it's just a beautiful neighborhood. It's a neighborhood that I feel appreciates good care, and we're happy to offer it. We treat a lot of headmasters of different private schools, a lot of the teachers from the private schools, a lot of the kids obviously from private schools around here. And we're just really, really very fortunate to have found a place that we can call home. We do some pediatrics. We prefer to wait, when the patients are a little bit older, in their teens. Parents very often will ask, can I bring my child here? And if they really feel like, they need to, we try not to say no. But in an ideal world, we'd rather wait till they were teenagers.